COVID, and I think we all know and understand this, represented a significant shock to the system. And its ongoing impact, together with associated backlogs, coupled with extraordinary levels of other illnesses this winter, is creating pressure that is truly unprecedented. And I want to just give some more detail to illustrate all of that. Firstly, on COVID, in the final week of 2022, the ONS estimated that 1 in every 25 people in Scotland had COVID. Now, vaccines and treatments, thankfully, have very significantly reduced the health harm of COVID, but even so, more than 400 people with that virus were admitted to hospital just last week. In total, there are right now more than 1,200 patients with COVID in our hospitals, and for context, that is double the number 4 weeks ago. Now, even if, and this is absolutely the case, not all of them are in hospital directly or solely because of COVID, nevertheless, the fact that they have COVID means that enhanced infection control procedures have to be in place, and that has an impact on hospital capacity. In addition to the ongoing impact of COVID, the NHS is, of course, dealing with backlogs of treatment built up in earlier stages of the pandemic. Now, it's important to say that progress is being made here. For example, over the autumn, more than 90% of operations were performed as planned, and the number of operations was a third higher than 12 months previously. So that's good progress, but the impact of backlogs remains significant. In addition to COVID, the country has been experiencing extraordinary levels of winter flu. More than 1,000 patients were admitted to hospital with flu during each of the last 2 weeks. And finally, there has also been a rising number of cases of strep A and other respiratory viruses, resulting in a significant demand for services. So the impact of this combination of COVID, flu and strep A is clear in the statistics measuring demand for health services. If we look at the 2 4-day Christmas and New Year holiday periods, NHS 24 answered almost 100,000 calls. That's the highest number in more than a decade. In the final week of last year, compared to the week before, calls to NHS 24 increased by around 50%. The impact on the ambulance service has also been significant, compounded by longer turnaround times, which I'll come back to later. But the ambulance service responded to more than 16,000 emergency incidents in the past week, which is 11% higher than the average over the last 4-week period. I want to stress at this point, though, the massive contribution that both NHS 24 and the ambulance service, through new and innovative ways of working, are making to preventing pressure on hospitals being even greater than it already is.